Welcome back to this week's edition of the 50th Anniversary Video Committee. We are here on the 7th floor of the K Tower, looking to speak with the 7B Renal Diabetes Unit.
Let's go take a look.
Great.
All right, we have Rebecca, 7B's manager.
Yes.
And we are hoping to find out what is dialysis or what happens on 7B.
So 7B is our renal diabetes unit. We care for patients who are in all stages of renal insufficiency, failure. Some of them are waiting for transplant. Many of them are on hemodialysis. But we also perform peritoneal dialysis on our unit. So it's a challenging unit, but it's also created a lot of teamwork, and our team is very special on our unit.
Love it. And how long does a patient on average stay on dialysis?
It really just depends on their individualized diagnosis. So as far as they could be an acute renal failure, which means that they came in septic or some other heart failure issues and need short-term hemodialysis. So they'll get like a short-term port or a central line, and they can go downstairs to our hemodialysis unit, which we partner with DCI. And they are contracted with us on the 6th floor. So the patients will go there for 4 hours, do their hemodialysis, and then come back to us on 7B where we care for them. But that could be a temporary thing where they just need a boost and their kidneys need a break, or long-term end-stage renal, meaning that they need a transplant. And so then they would work with the transplant team to work on placement and where they are on the line for that. So it's all dependent on the patient, but as well as I think we're very specialized here because we do heart and kidney transplants. And so with us being a very large cardiac driven hospital, obviously there's kidneys involved with the heart. And so we get all of them.
Very cool. Very cool. And who is your longest standing team member?
So Miss Penny Butler,
Okay.
she is our LPN on day shift here, and she has been here since 2007. And she's kind of become our mascot. She's our mom of the unit. Everyone knows of Penny. She actually received the first Daisy Award here at St. Thomas West. So we're very blessed to have her. I'd love to introduce you all to her.
Perfect.
Let's go find her. So, you were introduced as our longest standing associate and the first winner of the Daisy Award. Did you know that?
Yes. Well, I didn't know about the longest standing
For 7B.
For
7B.
Oh, for
7B.
7B.
For 7B.
Yes.
Okay.
Yes.
So,
I do know that.
what is your favorite part of working on 7B?
The people.
Okay.
I enjoy the people. I enjoy my coworkers.
Your coworkers? Okay. And if 7B had a theme song, what would it be?
Ooh.
I don't know about a song, but a phrase is "Lord help us."
Okay. Your specialty is renal diabetes.
Correct.
So, talk to us a little bit about the therapies or the things you do with your patients.
As far as the dialysis.
Dialysis or any specific care related to diabetes, etc.
I got you. Well, everybody gets their sugars monitored and we do the insulin and all that. But our dialysis patients, the kidney failure, there's 2 types. There's hemo, which we don't do up here.
Okay.
And there's CAPD, which we do up here, which is, I think it's chronic ambulatory peritoneal dialysis.
Okay.
And it depends on what the nephrologist wants. A lot of times it's 5 times a day. We do manual exchanges, but I've heard we're going to have some cyclers coming our way some point in time,
That's exciting.
which will be very helpful. And, the nephrologist usually puts the orders in for us to do. And then, we go in, we have to clean the site. We have to make sure they're draining, make sure they're filling, make sure there's no fibrin in the fluid. And if it is, then you've got to call the doctor, get orders for medications to go in that. because if you don't, they won't drain, they won't feel, so they don't get a good treatment.
Okay. What kind of training do you have to be able to give a patient peritoneal dialysis?
Well, we do like a class, a peritoneal dialysis class,
Okay.
and then going forward, it's usually on the job training. Somebody will work with you, you
Okay.
know, to help you through the first few exchanges.
Okay. Hi, Christina. I'm Leslie.
Hello.
Nice to meet you. And way to be thrown on the spot here.
Yeah, I love it. Thank you.
How long have you worked here?
Since November.
November.
I'm
Okay.
a travel nurse, actually.
Oh, great.
Yeah.
Okay. What does the day in the life of a 7B nurse look like?
Oh my gosh. Yeah, I would say lots of teamwork. Lots is happening at the same time. Lots of coffees involved. Lots of laughing, actually. Yeah, it's a lot going on, but it's high energy, which I
Okay.
like.
That sounds great.
Yeah. Day goes really quick. Love that.
Okay.
Yeah, I'm not sitting really.
Okay.
Get my 10,000 steps in a day.
Great.
Yeah.
Okay.
No.
Thank you so much for watching. We look forward to seeing you next week for the next episode of 50th Anniversary Video Committee.
Bye.